Most breast consultation appointments are an hour. Some of them, if somebody has a more complex situation, more complex anatomy, maybe an hour and 15 minutes. Sometimes a breast reduction consult will be 45 minutes. When you arrive to my office, you'll be brought back by one of our experienced MAs who will make sure that we understand what it is you're hoping to talk about during the appointment. And then she will have you change clothes. And then typically at my consultations, I have patients get their photos beforehand so that during the appointment, it's easier for us to look in the mirror and come up with a plan. But sometimes it's easier to sit and see yourself through photos of yourself. So I usually get those ahead of time. Typically, when photos are finished, my MA will come and let me know that you're here. We'll confirm that what we have listed as the planned conversation is in fact what you're interested in talking about. And will let me know any little bits that you guys discussed at that time. And then I'm prepped and ready to go. Sometimes I ask questions because they're very important that I hear the answer. And sometimes people, between the time that they talk to my MA and then they speak with me, a little bit of extra history or a little extra info pops into their mind. And so sometimes the answer changes just a little in the 5 minutes between when she asked you the question and I do. So sometimes I do, on really important things, we'll ask again. As far as bringing in things or information into the appointment besides yourself and your own ideas of what it is you're hoping for, if you're over the age of 40, to have had a mammogram before surgery. Now, that doesn't have to have been right before the appointment, but it does need to be planned and within a year of surgery. So knowing that you have good breast health is important. If you have photos of people that you have seen online or friends who have had surgery or have breast outcomes that you like, or honestly, sometimes if there's outcomes that you don't like, bringing those in so that we can discuss those as part of the conversation. And sometimes it's me pointing out, this is a great example of somebody who looks very similar to you. This is a reasonable outcome or expectation for you. I don't need 50 pictures, but like a couple of choice pictures that give me a sense of what your goal is often helpful, just because I can't see into anyone's mind. And discussing breast size based on cup size is challenging because bra cup sizes are all over the board. And so a C cup from bra line to bra line is just not the same. And how you want to fill out that C cup is variable as well. So actual photos of actual breasts is actually the most accurate way to relay our thoughts in a conversation. And I actually have photos in my office that I show patients, kind of scaling through cup sizes. And so if you don't remember to bring some in or grab some, I still have some that I kind of review with folks as well. I usually don't, when I'm talking about this, because I do talk to patients, because a lot of times they come in and I'm getting ready to examine them and they're like, oh my gosh, I'm sweating, and they're fanning their gown. And I'm like, you're here talking about something that you're not comfortable with on your body. And I'm about to take a look and we are about to point and examine that thing that you're not happy with. And that's how I typically sort of phrase that sense of vulnerability that they are experiencing, without using the word vulnerable. But that's what it is. It's anxiety provoking to sit there and have that exposure. Women will come in talking about what they do to keep themselves comfortable through the day. They may keep washcloths underneath their breasts to try to and change those out through the day, especially during summer months. That's particularly true with people who are coming in for breast reductions. It's also can be true for ladies who've had some drooping of their breasts. And then people will often dry underneath their breasts. They put powders, they do all kinds of things from a hygiene standpoint. They use different creams, some of which they feel embarrassed about, but it's just how you get through your day. I definitely point out on photos, how after a lift or a reduction, there is no more skin contact underneath where that moisture collects or where the skin gets irritated or where people sometimes get rashes. And so even when they stay at fuller sizes, the breasts are up and you don't have that place where the breasts sit on the rib cage, and therefore you don't have that moisture collect, that irritation, and all of that. And that's without a bra. And so when somebody has been using a bra to hold their breasts up and pull them up, and it's hanging on their shoulders, and they've got these dents here because their bra is doing the work of lifting. When it's just sitting there, then all of a sudden the bra is just there to kind of shape or control a little bit or stabilize. It's not being used to fully leverage things and pull them into place. And so I can show, again, for my breast reduction patients, where some of the notching in the before and the after pictures is oftentimes already sort of smoothing out or smoothed out. But most people, whether they have notching or not, can relate to that and what they're trying to use their bra to do to control things, and how when they're just sitting there, so much more manageable, and then the bra can be more pretty, less industrial. I do try very hard to manage and understand people's expectations, hoping that by managing those expectations, we end up with an outcome that everybody's thrilled with on the back end. And I will point out differences in anatomy or differences in height or size or rib cage size, or maybe what somebody's starting with. Sometimes people come in, maybe they've had children and breastfed, and they've had some loss of volume in their breasts, and they have some droop to their breasts, and they bring in photos sometimes of someone who is 20 years old and has a moderate or large breast augmentation with a tiny scar, maybe no scar around the areola or anything that's visible. And that is their goal, but they want that goal without scars. And on their body, that's not possible. And so I just try to be really honest about what can and can't be accomplished with different procedures. And in the end, if someone is certain that they can't live with those scars, then they kind of self-select themselves out of a breast lift as an operation for them. I think with the internet and research, most people have a general sense of what to expect or what you're going to talk about or what the conversations may entail. But people come from diverse backgrounds, wide array of exposure to things. And sometimes they walk in quite cold and are like, hey, I just always was curious. And I called and set up an appointment, and here I am. I know nothing. And that's kind of fun too, to kind of go through and be able to be that actual introduction to plastic surgery, to their concerns, without having any misinformation already floating around in their minds. And so for me, that's kind of fun sometimes too. If you want to schedule a consultation with me, you would call our number at Portland Plastic Surgery Group, 503-292-9200. And my scheduling coordinator is Araceli, and she would be able to get you tucked in and answer a bunch of questions for you as well to get you primed for your consultation.